Are you living with osteoporosis or at high risk for bone fractures? Have you heard about a new medication called Jubbonti? This video will help you understand what Jubbonti is, how it works, and what you need to know to make informed decisions about your bone health. Jubbonti, pronounced Jubbonti, is an injectable medication designed to help strengthen your bones. Its generic name is denosumab BBDZ. It's given as an injection under the skin, typically once every 6 months, by a healthcare professional. This medication is an interchangeable biosimilar to prolia, meaning it's highly similar and has no clinically meaningful differences in safety or effectiveness. It was approved by the FDA in March 2024, offering a new option for patients. Jubbonti is prescribed for several specific conditions where bone strength is a concern. It helps treat osteoporosis in postmenopausal women who are at a high risk for fractures. This is crucial for maintaining mobility and quality of life. Men with osteoporosis who are also at high risk for fractures can also benefit from Jubbonti. It helps increase their bone mass, reducing the likelihood of painful breaks. The medication is also used to treat glucocorticoid-induced osteoporosis in both men and women at high risk. Furthermore, Jubbonti can increase bone mass in men receiving androgen deprivation therapy for non-metastatic prostate cancer. It also helps women at high risk for fracture who are receiving adjuvant aromatase inhibitor therapy for breast cancer. These therapies can sometimes weaken bones, making Jubbonti an important supportive treatment. Our bones are constantly undergoing a natural process of breakdown and rebuilding. Specialized cells called osteoclasts dissolve old bone, while osteoblasts form new bone tissue. This balance is essential for healthy bones. Jubbonti works by targeting and inhibiting a protein called RANKL. RANKL is crucial for the formation, function, and survival of osteoclasts. By binding to RANKL, Jubbonti stops osteoclasts before they can reach and damage your bones. This action decreases bone resorption, which is the breakdown of bone tissue. In turn, it increases bone mass and strength in both the hard outer layer, cortical bone, and the spongy inner layer, trabecular bone. Essentially, Jubbonti helps your body maintain a healthier bone structure. Before starting Jubbonti, it's vital to be aware of certain serious warnings. Jubbonti carries a boxed warning regarding severe hypocalcemia, which means very low calcium levels in your blood. This risk is higher for patients with advanced chronic kidney disease, CKD, especially those on dialysis. The risk increases even more if you have CKD along with a condition called mineral and bone disorder, CKD-MBD. Your healthcare provider will evaluate your calcium levels and kidney health before and during treatment. Any pre-existing low calcium levels must be corrected before you begin Jubbonti. It's important to note that Jubbonti contains the same active medicine as prolia, xgeva, and Wyost. Therefore, if you are receiving Jubbonti, you should not receive any of these other medications simultaneously. Your doctor will ensure you are on the correct treatment plan. Serious allergic reactions, including anaphylaxis, can occur with Jubbonti. If you experience shortness of breath, throat tightness, swelling of your airways, itching, low blood pressure, or hives, seek emergency help immediately. These symptoms require urgent medical attention. Osteonecrosis of the jaw, ONJ, has been reported with Jubbonti. This is a severe jaw bone problem. Your doctor should perform a routine oral exam before treatment, and preventive dentistry may be necessary, especially if you have risk factors like prior tooth extraction or poor oral hygiene. Maintaining good oral hygiene throughout treatment is crucial. Atypical low-energy or low-trauma femoral fractures have also been reported. These are unusual breaks in the thigh bone. Contact your doctor immediately if you develop new or unusual thigh or groin pain. This could be a sign of a fracture. Multiple vertebral fractures, meaning breaks in the bones of your spine, have been reported after stopping Jubbonti. If your treatment is discontinued, your healthcare provider should consider transitioning you to another bone-strengthening medication. Do not stop, skip, or delay doses without consulting your doctor. Serious infections, including skin infections like cellulitis, can occur and may require hospitalization. If you develop signs of infection such as a red, swollen, painful area of skin that is warm to the touch, fever, or chills, tell your healthcare provider immediately. Other severe side effects include severe skin rashes, eczema, bone oversuppression, or severe bone, joint, or muscle pain. Always inform your doctor about any new or worsening symptoms. Before beginning Jubbonti, have an open conversation with your doctor about your complete medical history. It's crucial to inform them if you are allergic to denosumab or latex. Also, tell them if you are currently taking xgeva, as it contains the same medicine. Disclose any history of low blood calcium or if you cannot take daily calcium and vitamin D supplements. If you've had parathyroid or thyroid surgery, or intestinal surgery, your doctor needs to know. Inform them if you have trouble absorbing minerals, malabsorption syndrome, or have kidney problems, especially if you are on dialysis. A weak immune system or taking medicines that can lower your blood calcium levels are also important to mention. If you plan to have dental surgery or teeth removed, discuss this with your doctor and dentist beforehand. For females who can become pregnant, your doctor will perform a pregnancy test before starting Jubbonti. You must use an effective method of birth control during treatment and for at least 5 months after your last dose. Jubbonti may harm an unborn baby, so tell your doctor immediately if you become pregnant. If you are breastfeeding or plan to breastfeed, discuss this with your doctor. It's unknown if Jubbonti passes into breast milk. You and your doctor will decide if you should take Jubbonti or breastfeed, as you should not do both. Jubbonti is administered as an injection under your skin by a healthcare professional. You will receive this injection once every 6 months. This regular schedule is important for the medication's effectiveness. While receiving Jubbonti, it's essential to take calcium and vitamin D supplements as prescribed by your doctor. These supplements help prevent low calcium levels in your blood. Your doctor will guide you on the correct dosage. Maintaining good oral hygiene is also very important. Brush and floss your teeth regularly. If you need any dental work, especially surgery, inform your dentist that you are using Jubbonti. You might need to temporarily stop the medicine. It is critical not to stop, skip, or delay taking Jubbonti without first talking to your doctor. If you miss a dose or an appointment for your injection, call your doctor for instructions immediately. You should receive your missed injection as soon as possible. Stopping Jubbonti, or even skipping or delaying a dose, can significantly increase your risk of breaking bones, particularly in your spine. This risk is even higher if you have previously experienced a spinal fracture. Your doctor will discuss alternative medicines if Jubbonti treatment is stopped. Like all medications, Jubbonti can cause side effects. We've already discussed serious allergic reactions and severe low calcium levels. Symptoms of low blood calcium can include muscle spasms, twitches, cramps, or numbness/tingling in your fingers, toes, or around your mouth. Call your doctor right away if you experience these. Other serious side effects include severe jawbone problems, osteoporosis, unusual thigh bone fractures, and an increased risk of spinal fractures after stopping treatment. Serious infections in your skin, abdomen, bladder, ear, or heart can also occur. Watch for fever, chills, red/swollen skin, persistent cough, severe abdominal pain, or painful urination. Skin problems like dermatitis, rash, and eczema are also possible. Contact your doctor if you notice redness, itching, small bumps, dry skin, oozing blisters, or peeling skin that doesn't go away or worsens. Bone, joint, or muscle pain can also occur. Common side effects may include bladder or lung infections, headache, back pain, muscle or joint pain, increased blood pressure, cold symptoms, high cholesterol, or pain in your arms or legs. This is not a complete list, so always discuss any concerns with your doctor. You can also report side effects to the FDA. Always tell your doctor about all medicines you use, including prescription and over-the-counter drugs, vitamins, and herbal products. While formal studies are limited, some interactions are known. For example, calcimimetic drugs like cinacalcet may worsen hypocalcemia risk. Using other drugs associated with ONJ, such as bisphosphonates, may increase the risk of developing ONJ. Your doctor will review your full medication list to ensure safe treatment. Jubbonti should be stored in a refrigerator between 36 degrees Fahrenheit and 46 degrees Fahrenheit, 2 degrees Celsius to 8 degrees Celsius, in its original carton to protect it from light. Do not freeze the medication. It can be kept out of the refrigerator for up to 30 days at room temperature, up to 77 degrees Fahrenheit or 25 degrees Celsius, in its original carton. Do not expose it to temperatures above 77 degrees Fahrenheit, as this can affect its effectiveness. Do not shake Jubbonti. Always keep all medicines out of the reach of children. Jubbonti is an interchangeable biosimilar. This means it is a biological product that is highly similar to an FDA-approved reference product, with no clinically meaningful differences. For Jubbonti, the reference products are prolia and xgeva. An interchangeable biosimilar can be substituted by a pharmacist for the reference biologic without needing a new prescription from your doctor, depending on state pharmacy laws. This offers more accessible and potentially more affordable treatment options while ensuring the same high standards of safety and effectiveness. Understanding your medication is a key part of managing your health. Jubbonti offers a powerful way to strengthen bones and reduce fracture risk for many individuals. By staying informed and working closely with your healthcare team, you can take proactive steps towards better bone health. Do you have questions about Jubbonti or your bone health? Don't hesitate to speak with your doctor or healthcare provider. They are your best resource for personalized medical advice and to determine if Jubbonti is right for you. Share this video with anyone who might benefit from this important information, and remember to always consult your healthcare provider for your specific circumstances.